Hello everyone. Today we'll discuss about macrovascular complications of diabetes, which basically includes stroke, the heart attack or cardiovascular diseases, and peripheral artery disease. Basically, this macrovascular disease is a disease of any large or macro blood vessels. That's why it has been named as macrovascular complications, and it is a disease of large vessels like coronary artery disease, the aorta, and the sizable arteries in the brain and in the lower limbs. And these macrovascular complications are the cause for the most of the mortality which are associated with type 2 diabetes mellitus. As we have already discussed that in these macrovascular diseases there is involvement of large and medium sized blood vessels. If the coronary arteries are involved in these complications, so they result in acute MI, myocardial infarction or angina pectoris. If there is involvement of large or medium sized arteries or blood vessels of cerebral region, this causes either TIA, the transient ischemic attack, or cerebrovascular accident. So TIA means it is the rupture of any artery with bleeding into the brain, that is known as hemorrhage, and this CVA is also known as cerebral infarction or stroke. If the symptoms of this hemorrhage, brain hemorrhage, are temporary, usually lasting for less than 1 hour, then it will be termed as TIA, transient ischemic attack. If the symptoms are persistent for longer than 1 hour, then this condition will be known as cerebrovascular accident or cerebral infarction or stroke. If there are involvement of peripheral arteries, so this will lead to generation of peripheral arterial disease in the lower limbs. So we can say that this macrovascular diseases usually involves and causes the stroke or cerebrovascular disease, or it can cause coronary artery disease, or it can cause peripheral arterial disease. It has been noted that in individuals with diabetes have 2 to 4 times higher risk of development of this stroke oblique cerebrovascular disease. In individual with diabetes have 2 to 4 times higher risk of coronary artery disease, and individual who are with diabetes have 2 to 3 times higher risk of developing of peripheral arterial diseases. Now let's see what are the difference between microvascular complications of diabetes and macrovascular complications of diabetes. So the macrovascular complications can occur in individual without diabetes also. There is no any compulsion is there that individual will have diabetes, then he will develop macrovascular diseases. However, in case of microvascular complications, these complications are specific for diabetes, means the person will develop these microvascular complications only if patient has any clinical diabetes. Otherwise, there are no or rare chances of development of microvascular complications. For screening of macrovascular complications, there are no clear-cut screening protocols which have been devised or validated. However, for the microvascular complications, there are clear-cut screening protocols which have been already devised and validated. Macrovascular complications are multifactorial, means there are many risk factors or causes to generate these macrovascular complications. So because of that, we will require a multi-pronged approach to prevent or to treat these macrovascular complications. However, these microvascular complications are directly linked with the severity of diabetes or hyperglycemia or duration of the hyperglycemia or diabetes. So now let's discuss what are the risk factors for the macrovascular diseases. As we have already discussed that the macrovascular diseases are complications are multifactorial in nature. So the risk factors for this macrovascular disease or complications can be broadly divided into two categories: the modifiable and the non-modifiable risk factors. Modifiable risk factors mean which can be changed, which can be modified, and non-modifiable means the factors which can't be modified or which can't be changed. So when we see the non-modifiable risk factors of macrovascular diseases, it includes the age. Whenever there is increase in age, the risk of development of macrovascular diseases also increase. Sex or gender, and the family history of diabetes or family history of development of macrovascular complications are non-modifiable risk factors. When we see the modifiable risk factors, it includes smoking habit, the hypertension in the person with diabetes or dysglycemia in the person, dyslipidemia, abnormal lipid level, the sedentary lifestyle, and obesity. However, there are some protective factors against these macrovascular complications, which include exercise or physical activity, the high HDL cholesterol, which is a beneficial cholesterol, and if there are some stress reduction activities, then all these factors are known as protective factors. As we have discussed that macrovascular diseases are multifactorial in nature. It includes various modifiable and non-modifiable risk factors. However, the main pathology behind this development of macrovascular disease is atherosclerosis. So atherosclerosis means thickening or hardening of the arteries, and this atherosclerosis is usually caused by buildup of any kind of plaque in the inner lining of artery, and this plaque is usually made up of deposits of fatty substances, the cholesterol, the cellular waste products, calcium, and fibrin material. This atherosclerosis can be manifested at much younger age, and this manifestation is usually more extensive and severe. There are various reasons for development of this atherosclerosis phenomena, which includes the insulin resistance, and we have also noticed that the hyperinsulinemia, increase in insulin secretion, is also a potent atherogenic agent. The second cause for development of this atherosclerosis is diabetic dyslipidemia, the disorder of lipids and cholesterols, which also causes the development of highly atherogenic lipid levels. There are some inflammatory markers like C-reactive protein and TNF alpha, tissue necrosis factor alpha, which are also be found to be elevated in type 2 diabetes mellitus, which are also a risk factor to development of atherosclerosis. We also know that hypertension is very common in type 2 diabetes mellitus, which is also a risk factor for atherosclerosis. Apart from that, there are various factors which are raised in case of diabetes, which lead to generation of this atherosclerosis. These procoagulatory factors are fibrinogen, the plasminogen activator inhibitor 1, which ultimately cause the formation of plaque and ultimately atherosclerosis. Here in this picture we can see how the endothelium of the artery has various deposits of waste products. Here in this slide we can see how the atherosclerosis develops in diabetes through various mechanisms. These mechanisms include the endothelial dysfunction, and which is due to the involvement of various factors. Other mechanism is inflammation, and the third and last mechanism is fibrosis and remodeling. We should know about the ticking clock hypothesis, and as per this ticking clock hypothesis, the microvascular complications, the clock starts ticking only when there is onset of hyperglycemia, means once the patient has developed diabetes, then the ticking of this clock will start. However, in macrovascular diseases, this ticking of the clock starts at early ages, at the stage of pre-diabetes only. It means we have to be very cautious in respect of macrovascular diseases. To summarize this presentation, the macrovascular complications are due to the blockage of medium and large sized blood vessels. This blockage of medium and large sized blood vessels usually affect the heart, brain and peripheral blood vessels of the limbs, and the atherosclerosis is the main phenomena behind these macrovascular diseases, which causes alteration in the vascular hemostasis. This atherosclerosis process involves from the initial fatty streak development to well-formed plaque, and ultimately it gives rise to vascular occlusive phenomena. And this accelerated atherosclerosis affects the heart and brain of the patient, and we can say that in diabetes there is disturbance in the vasoactive factors, which ultimately leads to dysfunction of the endothelium of the arteries, which ultimately causes the development of macrovascular complications in diabetes. Now we have come to the end of this video. Please like and share this video with others. Thank you so much.